Hey guys, welcome back to another weekly episode of the Rated RX podcast. Thank you all so much for joining us. We're excited for you to tune in and listen as we talk about the quirkiness of our dispensing lives and careers and other funny healthcare related stuff. Before we get started, Sam, Xavier, how are you guys doing today? How's things going for you guys?
Life is doing well. Got to see some family this weekend. Have some fun. Got 4th of July coming up, so get to hang out with some of my cousins. Should be fun. Hopefully the weather's all good. See some fireworks. Should be fun.
Nice. Same for me. I'm tired. Burning 2,000 calories a day playing basketball. That was crazy. But other than that, this weekend we're going up to the lake in the mountains, and we're gonna do 4th of July out there. Got a little Airbnb going. Watch some fireworks.
Nice.
Spend some time with the wife. Fun stuff.
Nice, dude. That sounds nice and fun and relaxing. Just a couple people in the woods and the mountains and with their shenanigans. Yeah. I'm doing pretty good too. 4th of July is coming up. I'm very pumped because I have the day off and the 3-day weekend for me. So hell
Same.
yeah.
Let's go.
Doesn't happen very often when you you work in a hospital. So I got to take the wins while you can.
Yes, sir.
All right, then. Well, we'll jump into it, boys. I'm going to pass the mic over to Sam, who's got a Plan B blind draft for us. Sam, please take it away.
Okay, doing another Plan B blind draft. This one is going to be things we wish we could say to our patients, but don't.
God, you're going to get me in trouble, man.
There's nothing. I didn't go off the deep end. Okay, there's nothing too crazy in
Don't
here.
get us canceled.
Okay, so some things we wish we could say. Know that have been irritating, repeated questions or things irk you as a pharmacist professionally. And it'll be five of them, blind draft. Don't know what's coming. You got to rank them 1 through 5. Number 1 will be the most irritating, annoying thing, or most thing you'd wish you could say to a patient, but don't say because you're professionals.
Okay.
All of these will be number 1. So we don't say them because we're professionals.
First one, things we wish we could say. The drug you saw on TikTok is not FDA approved or real.
Oh, man. I mean,
I think we would say that one, right?
I would say that one, but I wish I could say that, but so it's not too bad, right? Is that how you interpret that? So,
right. So there'll be a lower, about like a 5.
Yeah. That's what I'm thinking too. Yeah. I would straight up say that without any issue. Yeah. So let's go 5. Let's go 5.
Let's
Okay,
do it.
5. Next one, things we wish we could say to our patients. Natural does not mean safe. Arsenic is natural too.
I've said that. I've said that a lot.
I said I'm not crazy. I'm trying not to get canceled over here.
Go back and listen to the previous podcast.
Yeah. Well, that's a 4 for me just because I said it. I don't wish I could say it. I will straight up say it. So, what do you think, Zay?
I agree. Number 4.
Are you playing a prank on us, man? Are you just like...
I told you it'd be easy. I told you there's nothing to be crazy.
Okay.
All right. Third one. If you don't know the name of your med, I definitely don't.
Well, I can find out.
Yeah. Ooh. I mean, with that attitude, definitely like a 1 or 2. So, it's on the closer to the 1 spectrum for me.
What do you wish you could say? Yeah, at least the 2 at minimum.
Yeah, let's go 2. Yeah,
2. Okay.
I wish I could be that snarky to someone without getting in trouble.
Okay, you got 1 and 3 left. Next one. You waited 14 days to pick this up, and now it's my fault it's gone.
Well. Oh man, I'm tempted to say 1, but we don't know Sam. Let's just say 1. Yeah.
Well,
1.
This is one we shouldn't say.
Okay, that's 1. So then your last one at spot 3. You're telling me you found it cheaper online? Cool, buy it there.
That's not too bad.
No,
it's the delivery.
It fits for 3. Yeah, you just can't be rude with it, right?
Exactly.
All right, so you guys went number 1, you waited 14 days to pick this up, and now it's my fault it's gone. Number 2, if you don't know the name of your med, I definitely don't. 3, you're telling me you found it cheaper online? Cool, buy it there. 4, natural doesn't mean safe. arsenic is natural too. And 5, the drug you saw on TikTok is not FDA approved or real.
It's a good list. Honestly, if you had given them to me beforehand, that's probably how I would have ranked it. We're good at this, man. We're good.
We've been
Sam,
killing these.
come on, man. Step
You
it
gotta
up.
make it harder.
You got to make it hard.
Okay. If you say so. Okay. You're entering that cancel. First, you're crying about possibly being canceled, and then just flipping it over here.
That was too easy. Too easy.
We need somewhere in between.
Yeah. But we'll take it. I'll take the victory. I need always taking the dub.
No, I heard you had a hard week. I was just trying to prop you up.
Hey, we appreciate it. We appreciate it.
All right. Well, thank you for playing, boys. And then we got Xavier for a pharmacy fact.
All right, guys, welcome in to the pharmacy fact. Y'all like my reporter voice? Is it decent? No, not bad. Okay,
You sound like a reporter. Yes, from the 80s.
Hey guys, so the fun fact today, we're talking fireworks because the 4th of July is coming up. And did you guys know that fireworks light up the sky, but they also light up the ER? There are over 10,000 injuries caused by fireworks every year. But believe it or not, pharmacists can be the first line of defense when it comes to treating, minor burns, a little skin tears, smoke-related irritation. We got the OTC stuff ready. We can help you with some of those smaller things so you don't clog up our ERs for people who, blew off their leg. They need that space. But we can recommend like small things such as topical ointments for burns. We have dressing stuff, pain relievers, and even tetanus shots if you need those. But probably want to go to the ER to get a tetanus shot.
Tetanus shot for what do you call it? A firework? Really?
Not
I didn't know that.
Firework. It's kind of like
got some metal shards that came with it.
Skin and then you get something in there.
Interesting. Okay, I didn't know that.
Yeah. So if it's minor, we might be able to help you and save you a trip to the ER and try not to blow off your fingers this 4th of July.
Yo, like real talk though, I hear that like come July is when like the new grads from med school become residents. So and it's usually the resident in there treating
week one this week.
Week 1, all the attendings obviously like want to take the day off, relax. So this is the worst time to blow your finger off because you don't know the skill set of that person.
That leads me to my first question. And do you guys the only one that ever got hurt by fireworks and what happened?
Not me.
Really?
Yeah, I've been lucky.
Ones that I've seen only getting hit by them. I'm sure that happens all the time. But I remember one time one of the ones that will shoot up fell over and it shot up the driveway and hit my mom. She was like trying to turn and run from it, and she was quite a ways away. But it was a funny scene watching that. So
she's okay. She was okay.
She's okay
afterward.
Okay. Yeah. Probably had to go to the pharmacy and get a little of that topical ointment for some burns, but that was about it.
Maybe some new underwear too, because I probably would have crapped myself.
Yeah, maybe.
I have 3 good fireworks stories.
3, okay.
I'll make them quick. But as a kid, we always had the neighborhood. I lived in Mississippi, rural area, so lots of space to have firecracker wars. So we would have wars in the neighborhood. So everyone buys $200+ worth of fireworks, and we just had an all-out war trying to blow each other up. It got pretty crazy, but I got fond memories as a kid. One time, my cousin hit me with a Roman candle. My shirt caught on fire. I was running around with a whole burn in the back of my shirt, and I was like, on fire. So that's one of them. 2, also when I was a bad kid, we did have a local, like a neighbor who drank a lot of alcohol, and he was in the area, and I stuck a firework in his pocket and kind of burned him a little bit. But that was bad, Xavier. That was bad, Xavier. Don't do that. Don't recommend.
Now you're a pharmacist and thriving. Look at you.
Yes. I got my act together. And then the last story, one of the funniest ones I can remember. Y'all know the large fireworks that shoot up in the sky and they just splash out. You see the lights everywhere.
The mortars.
So we usually end the night with the mortars, right? So I lit the mortar, and then when the stem sparked and started to catch on fire, everyone was a little bit close to it. So, but like when everyone ran away to clear the area so it can shoot up into the sky, it fell over.
Oh,
And
no.
everybody looked at each other like, and it
As in a tube, the tube
exploded.
fell over.
The tube fell over, and it just
Oh.
shot, and it like shot into the ground, and then it just exploded everywhere. And all you see is like, it's like a movie, like all the firework lights just shooting past people. And it's like you're in slow motion. Like, it was crazy. But yeah, that's one of my three fun fireworks stories. I love 4th of July, but I don't try to blow stuff up anymore.
So it fell over, or you knocked it over?
The person that was next to me,
Oh, there was a hesitation
There's
there.
a nuance,
Okay, that's
nuance
all
of
we
a
needed.
difference there.
That's all we needed to know.
I don't think it was me. I don't know. I took all running, but somebody knocked it over.
Mm.
And that's why the ER is so packed on this time of the year. People like Xavier getting their hands on some nasty fireworks.
I'm sure all you kids were wearing protection, eyes and face, and I'm sure
Yeah, definitely.
very safe.
All
Safe,
right.
dangerous kids.
Stay dangerous, everyone. Happy 4th of July. And now we'll pass it over to Sam to read the weekly weigh-in.
But did you say stay dangerous?
Stay dangerous. Stay dangerous for sure.
Oh my God! Disclaimer:
Stay
don't
dangerous.
stay dangerous, please. Be safe.
Dr. Danger.
Hey, everyone tells you to be safe. We need somebody to say be dangerous out here.
Oh, well, boy. Okay. All right, we got our weekly weigh-in. We have a username, Thunderstorm Catnip. And we're
like
talking about
Whoa.
nurses. Why do nurses always blame pharmacy when things go wrong? To be fair, no one is perfect, and we all make mistakes, but I have come across a handful of nurses who seem to always blame pharmacy first and don't take responsibility for their own mistakes. Some would even lie or exaggerate just to get out of trouble. It's disgusting. So, first question, do you agree with that statement that nurses are always to blame? Why or why not? Xavier?
It feels like it for sure, but I don't think I think that they're scared and they need to blame it on someone. And the pharmacist is the easiest person to blame it on sometimes. So yeah, it definitely happens. But hey, we all try to work together, prove their errors. And yeah, I don't think they intentionally do it. I mean, some people might just, they did something completely wrong. And the pharmacist was always chewing them out or trying to like, hey, you're doing this wrong, and catching errors on them and jaspering them or something or reporting them. So they're like, oh yeah, it's my turn. It was the pharmacist's fault. But yeah, I could see where this person is coming from, and it definitely feels like it a lot. But I don't want to cause any divide between the pharmacists and nurses because we do have a good working relationship. So I'm gonna say, I'm gonna stay in the middle and play Switzerland here.
the PC answer.
Robbie?
No, I think that, when you're working in a pharmacy and you take calls, you're going to be getting complaints about your department, of course, from all other departments. I am sure that they are complaining about other departments, but they're not going to call pharmacy to complain about PT, about OT, about social. Oh, do they? No, not okay. Well, not in my place. Yeah, okay. But
they call pharmacy for everything.
They call pharmacy when there's a social work issue?
If they don't know the answer to a question, they call pharmacy first.
Yeah, no, but that's different. That's like seeking help. The question is, do they blame pharmacy? And what I'm saying is, they're not going to call to blame a social worker to the pharmacy department. They might ask a question, sure, but that's what I'm saying. It might feel that way because, it's like no one, like they're calling to complain about pharmacy because you are the pharmacy, right? So
right.
I think there's a little bit of selective biasm there, like just because of the way things are structured. And also, like, pharmacy is separated from everything too, so maybe at times it's easier to blame the person you can't see, right? Like, because they can't defend themselves. And I really do feel bad for nurses because they do sort of like they're front facing the patient, right? So if something goes wrong, they get lashed out at the patient lashes out at them.
Mm-hmm.
Doctors slamming on them. I mean, I'm sure even now, have you guys seen that video of the surgeon like cussing out the nurse in the ER room because of suction? If you guys haven't seen this, listen to this audio. It's pretty messed up. But basically, a surgeon is operating and he's got and he's trying to like suck out fluids from the surgery, and he's telling her it's not sucking, and she says it's on. And then he basically scolds her and kicks her out of the ER room and says, I'm a surgeon. Oh, like, don't tell me like it's not working. I know when it isn't working. And then so she leaves. And then on the video, he's like cussing her out, like, that stupid effing bee, dumb bee.
Dang.
She doesn't know what
Damn.
she's and dude, and it went on Facebook Live, dude. It went on Facebook Live. So, it's, I feel for nurses, man. They deal
they
with
got-
all the crap, and they deal with crap from every department. And so it's a long way of saying no. I don't think they blame pharmacy. I think everyone blames nurses,
Yeah.
because they touch every department. But no, I don't think I think it's just a selective biasm thing. Like, you're not going to call pharmacy to complain about a social worker, right? You're going to call pharmacy to complain about pharmacy. But I encourage you guys to watch that video if you haven't seen it. It's very cringy. It's very cringy.
He sounds like an asshole.
He is, yes. And I'm sorry, I know we're deviating from this. She got fired, dude. She was fired. Can you believe that? Yeah, straight up after that, kicked her out of the ER, cusses her out, fires her.
Damn.
Yeah. So I feel for those nurses, man. I really do.
Sounds like a maybe case if she didn't do anything wrong.
Yeah, we'll see.
It's crazy. I would say, I haven't really experienced like the idea of nurse or anyone else like lying or really exaggerating thing. I think everyone gets irritated with everyone at some point, of like whoever you have to call. You have to make a call. Like, yeah, sometimes it's fine. Usually it's fine. Sometimes you're irritated. Sometimes it's just this phone tag, or they said this and trying to communicate through this. It happens to everyone, nurses included, pharmacists included. And yeah, sometimes it's get irritating, but I don't think they're out there lying about things. It's, again, I would say that's an exaggeration of it. It's like, yeah, I thought I heard this or heard this, and it's like, okay, well, it's a little bit different on what's going on. I think it's a little unique in that, compounding is a little specific on certain things. So it's, some unique things that they're not used to. Like, we get a lot of questions on, like, can you clarify this one thing of, like hormones, Triast, something like that. And they call back. It's like, yeah, it says Triast 2.5 milligram. It's like, what do you guys want? It's like, okay, we can make literally anything. I need to know how much estriol, how much of this, how much estradiol. Like, we need the exact number. We can do anything you want. And like, oh, okay, yeah, I don't know that. We got to ask the doctor. So like little specific things like that they're not used to. Regular pharmacy, you would never have that issue. So that's usually the most common things of, it's just our specific field is unique, where we're not used to communicating back and forth with everyone with something like that.
Yeah, and I think that's like a big challenge for nurses too, because they're sort of the middle person. Like, the doctor needs something, the doctor tells the nurse, the nurse thinks it's going to be a simple thing, delivers the message, but that message isn't clear. It comes with questions, and they're a deer in the headlights, and that's not their fault. That's just a poor chain of communication that was initiated, right? Kind of like, them calling in a prescription.
I agree. Do you guys think or you remember at all a nurse trying to pin the blame on you for something, or throw you under the bus on anything specific, remembering what happened or whose fault it might have been, or how you felt about that interaction? Xavier, any jogging any memory of that?
Nothing specific for me. The only thing I can think of briefly, it's just the only thing that's popping in my head right now. It wasn't a nurse; it was a medical resident, and he was asking one of the pharmacists to help him with an order, I think, or order or discharge or something like that. But the pharmacist was like, "Hey, you have to do it, but here's what you got to do." And then it didn't get done until later. And then the evening shift pharmacist came in. He asked that pharmacist to help with it, and then they helped with it. He was like, "Yeah, I'm gonna get on that pharmacist about this. He said he was gonna do this." But like, it was technically the doctor's responsibility to do that task that time. So I mean, doctors sometimes blame too. Sometimes it just depends. But yeah, no specific like things that happened to me that I can think of. Maybe if Robbie had something, and maybe he'll jog my memory or something else. But Robbie, anything?
Yeah. Just curious though. But what was the task that the resident was supposed to do that blamed the pharmacy?
So he did really have to do I think he wanted the pharmacist to put in a specific order, but like, we don't have to help them put in the orders. They order it and then we check it. But we help them sometimes if they're struggling. We can help them put in an order and then they sign it. But he kind of was like, "Hey, can you put in this order?" And but he was supposed to put in an order himself.
See, that's also problematic because, like, you know, I hate doing that because it's like who's checking like I check their work, who checks my work? Like if I put in an order, like that has to be 100% legit because it's going straight to the patient's profile, right? So there's no second.
Robbie typed it up. It's good. Let me sign this, baby. We're good to go.
Yeah, exactly.
They might not check it. They're like, oh, I trust the pharmacist, and then they just sign it, you know. And then
that's how mistakes happen.
Yeah, so that's why the pharmacist didn't put it in, because he was like, I'm not putting the order in and then verifying it myself. It's like me doing the whole thing. So the
like
doctor
self high five, right? Yeah.
But I think he just didn't know how, and they didn't ask. So you just gotta ask.
Gotcha.
If you don't know, we're here to help.
Gotcha. Okay. Wow. Well, I'm glad it was resolved. Yeah, for me, so nothing comes, like, I can't think of an instance where I've been blamed. I've been pretty lucky thus far. But as far as things that have happened where, you know, fingers were pointed and like, because this was sort of a big issue there, because a lot of best practices from both departments weren't followed. The person who was staffing inpatient pharmacy had, that day had multiple LAIs, long-acting injectable medications prepared for multiple patients on the unit. It was in Vega, Sustaina. There was someone getting like the first dose and the other person getting a second dose, or two different doses. And nurse came in to get the med, and pharmacist gave it to them, handed them the wrong med, the wrong strain for the patient. Yeah. And then another person came in, and when that nurse came in to come get the second one, she noticed that it was off, and then it sort of caused this big panic freak out, like, oh my God, where'd the other one go? And then that's when they realized the other one was taken and given to the other patient by mistake. I can't remember if the other person got a stronger one or the weaker one, but they got the wrong dose from the wrong person, and it was there was a lot of finger pointing because the nurse who picked it up said, well, this is what the pharmacist gave me, but then the pharmacist said back, well, you didn't tell me who the patient was. And so it's just kind of like, y'all messed up. Okay. Yeah, like that was bad practice, you know, like you should have asked who it's for, date of birth, like both of you are held accountable, but just like a lot of finger pointing. Right. And so that led to like a big departmental thing of like, okay, you know, like, remember, we're supposed to be asking for date of birth. We're supposed to be verifying the patient, verifying the drug. So now it's like, hey, I'm picking up an LAI. It's like, you have it with you. Who are you picking up for? What's the strength? What's the date of birth? You know, and it's all these things they should have been doing initially, but it's just like, you know, one of those things, that scary things that happen where you just need a little reminder. It's like, this is the best practice. You're supposed to be doing it. And so I don't know if personally, I'm kind of siding with the nurse on this one. You know, it's just like it'd be like no difference if, in my eyes, it'd be no difference if a patient picked up a drug from a outpatient retail pharmacy, right? And they hand him the wrong drug. Like, it's the pharmacist's fault, right? And yeah, it's the same thing, but just a different environment. So I don't know. It led to obviously a bigger thing where, you know, a hospital kind of cracked down on that policy, but you know, things happen. You know, nurses blame pharmacy and vice versa. So, but I guess happy ending. Everyone was reminded what to do.
Except for that patient.
Yeah.
I just said improve the protocol, improve the policy.
Yes. Well, not improve, follow it.
Well, yeah. Enforce the policy.
Yes, exactly.
I don't think I have anything specific or like major interactions with nurses. Again, usually it's just some communication thing of he said, she said with third parties. So it's going through multiple people, and it just goes back and forth. I think the one thing that comes to mind is like a very specific thing where we have to have a wet signature for prescription, and we have to have the physical prescription, and the clinic like kept sending it to us, and like you can see on there, like, this is a faxed copy, or like this is a printed copy. It's like it has that like grainy squares kind of thing on it. It's like, yeah, that's not an original. And then they keep sending, it's like, hey, this is not the original we need. It's like, okay, yeah, we'll send it over. And then you get it, and like the next one, and it's like the exact same signature, the exact same spot on the line, the same like skewed off to the side. It's like, these are exact copies of each other. Like, this is not a signature. And like, I remember getting a nurse, and like they were just so irritated with me, like when I talked. And it's like, even like getting the address from me, and like I'm holding 3 copies in my hand. Like, I know the address is right. We keep getting them. It's just like, I just need a wet signature. Like, how do we not get this through to communicate? Like, this is all we need. All the things are written correctly, all the drugs. This isn't a legal script. We need the wet signature. Just go. Like, I remember trying to like explain. It's like, whatever you have in your hand, go find a blue pen, have your doctor sign next to whatever's on there with a blue pen, and send us that. And trying to get them, and for some reason, it was just such a hard concept of like whatever they kept sending us through their team. You know, I think I was just speaking to one person. I don't know if they were the ones dealing with it or separately, you know, and they were trying to relay it to someone else. And it's like, all we need the actual wet signature to get this through. And I think that was probably the hardest long period of trying to do that.
At what point can you just can you just take a verbal at that point? Just be like, right. Like, you have it, you verify it. Could you just write verbal and now it's done? Or like, why did it have to be signed at that point?
Because it's for the medication aid and dying. So there's very specific laws involved with it.
Okay, I didn't know.
And again, that's where it comes up to, because a lot of them, it's like, can't I just fax this to you? Or can't we just get a verbal, or, you know, whatever or one of the things is like the patient can't bring it into us. Like, you could a C2. It has to come from like an agent of the clinic or through like a courier company or whatever. Mail, something certified. So there are very specific laws involved with it. And I think, you know, obviously part of it too, where you're questioning, it's like, why wouldn't this work? It's like, yeah, they have specific rules involved with it.
Wow. I mean, we don't do medication aid and dying here, at least not that I know of. So, but I didn't know that. Like, it has its own unique carve out of what makes it like authentic for a prescription. So that's interesting.
Yeah, they probably got a lot of extra red tape to jump over to make sure, because they kind of want to prevent it probably. But so it's like, you got to do all these steps to be sure you want to do it.
Luckily, a lot of that tape is on the luckily for us, it's on the physician side. Like, they have to go through a whole bunch of steps to get through this. So like once we get the script or they're to the point of writing it, like a lot of the tape is essentially already been done. And obviously there's more specifics to it, but we don't have to deal with a lot of that, luckily. So it sounds like you guys have, or at least have, nurses that you've in practice you worked with. So, you know, nothing that I ever deal with, but for your relationship with nurses at the work site, can you expand on that at all, Xavier?
Oh yeah, definitely. So I'm a floater pharmacist. So I float all over the hospital from the different wards. I cover every medicine team 1 through 7. I cover ICU, I cover in the ER, nursing homes, spinal cord, blind rehab, everywhere almost except psych. But in these different areas, you get to know the nurses that you're working with. And I got my favorite nurses on each floor. And then as I'm walking around the hospital, I'm like, oh, hey, how you doing? Hey, how you doing? I'm a very talkative person, so I definitely chat with the nurses and get to know them as people. They're all fun, amazing people, and if they like you, they'll do more for you or help you out when you're in a pinch. So I definitely strive to make a good relationship with all my nurses. I'm in the hospital, and then you just kind of get to know the nurses better, because it helps you figure out like, okay, which nurse will be best for this, or who's your go-to nurse for this situation, and different things like that. So yeah, I have a great relationship with the nurses at my hospital.
Very good. Robbie?
Yeah, I'm pretty lucky. I have a really good relationship with all my nurses at the hospital. They get excited when they see me covering the transitions of care discharge. They're like, yes, it's Robbie today. So I'm just like, wow, I feel so special. You're excited to see me, Another nurse was telling me, is like, I've decided you and, just out of the blue, you and, another clinical pharmacist, I won't say his name, like, you two are my favorite pharmacists. You guys just know what's going on all the time. And I'm just really glad when you're the one covering this shift. And I'm like, oh my God, thank you so much. But yeah, like Xavier said, they're just like us. They're there to care for patients. They're there to make a living, just like the rest of us there. It's sometimes I'll goof around. I'm just hanging out at the nurse's station. Just sit there, shooting the gossip, seeing what's going on. I'm like, oh, I don't want to go back to my desk. Let me just sit here and chat with everybody for a bit. Like there was one time too where I was waiting to discharge counsel patient, but social worker they were taking their sweet time going through everything. And so I noticed, I was like, oh cool, Tarzan's on. I'm gonna watch some TV while I wait. And the nurse was like, what are you doing? I'm like, I'm just waiting and watching some TV. And she's like, Well, I got to keep an eye on everybody. I guess I'll sit here and watch some TV too. And we just out there watching Tarzan. So, yeah, I would say, I mean, that's just one example. I would say I have a pretty good relationship with the nurses. It helps to be a good pharmacist because they'll definitely tolerate more of your shenanigans, like mine, I guess. So, yeah, I'm very lucky. I'm very lucky. I say this now. Now I'm going to get to work and they're going to be like, damn you, Robbie, what'd you do? I'm going to jinx
Policy
myself.
change.
No tease.
So I guess
Sorry, I just want to add one more thing. I also think it's nice though, because you have a good relationship with nurses. If they don't know something or they're scared, scared to do something or questioning something, they'll feel more comfortable asking you a question. That also can help prevent errors because they're comfortable with you and they're not afraid to ask you questions and you help them out. So.
Yeah, trying to communicate, understand what you're trying to do. So a little bit on the flip side almost of that, experiencing kind of that, we talked a little bit about finger pointing between nurses and pharmacists or just other colleagues. How do you guys feel you can deal with that, experience it, either push back, get mean, accept it, be professional? What's the go-to on kind of having that finger pointing going around either between colleagues or nurses?
So this has been done in my hospital a lot in the past. So when I got to the VA, I had to realize this, you really have to do defensive writing and defensive note taking. So let's say I'm dealing with a heparin drip. I'm going to explain that I called the nurse. I verified the rate that the heparin drip was running. I've asked them if they saw any signs or symptoms of bleeding with the patient. If they say no, I'm going to document that in the message, and then I'm going to relay, the rate change or whatever to the nurse, and then notify them when I put in the order. So in my note, then I'll go back and clearly document everything I just told the nurse, who I spoke with, and do very defensive writing. Or anytime you do anything, y'all always want to document it in the chart if it's something that they should do or you spoke with someone. That just kind of helps cover you and make sure that you did the correct things. And if you didn't, there's also in the note, so then they can see, oh, you didn't do this. So defensive writing is one way to kind of help with the finger pointing, because nurses do the same. I called the pharmacist about what rate to run the fluids at, and he said it was okay to run this fluid with this antibiotic, and Xavier said this. So they do the same. So you have to be defensive with your writing sometimes.
Okay. Good writer. Robbie, any experience, words of wisdom on professional finger pointing?
Definitely, as I say, CYA, cover your ass, do some defensive writing. As far as, if I make a mistake, I genuinely want to know and I want to improve myself so I can prevent doing that again. So if I have a finger pointed at me, I want to understand what I did and why and how I can prevent doing that again. I make mistakes, and I'm not going to blame anyone else for my mistakes. So I don't know. I think you need to be humble, and you need to accept when you make a mistake and improve. I mean, at the end of the day, you want to grow professionally. You want to grow, and maintain relationship and face with your coworkers, right? So they'll remember if you lie, if you try to point fingers and blame, and you just don't want to be known as the liar, as the blamer. So I would just say, definitely cover your ass, do some good note taking, good writing, and if you make a mistake, fess up to it. It's an accident, and I think your manager and the other departments will understand if it's a genuine accident, if it wasn't anything malicious. And so just see what you could do to improve, and they're pointing fingers at you for a reason. So understand why.
Sure. I could say, it can be tough to have fingers pointed at you or to admit mistakes. I'd say trying to be accountable. It's going to happen. You're going to make mistakes, big or small. Usually they're not too big, hopefully, but it's something that you can do procedurally wrong, or, something where it's just not the way it was requested or done, and trying to be accountable for that, as you're saying, trying to be better. So I think it does go a long way to show you being accountable on something. Yeah, it's we messed that up, or I messed that up. It doesn't even need to be you. Kind of, we talked about techs and defending them and whatever. It's, yes, we did mess this up. We can try to help or go from here on, still having that level of accountability. Any final notes?
Be nice to your nurses. They deal with a lot more than you do, you know. And they call and ask for help, but if you know the answer, don't be a jerk about it. Try to help them, because if their life is easier, your life is easier.
Yes, at the Rated RX podcast, we love nurses.
Put that on a badge. All right. Well, thank you for weighing in. And then we have Robbie taking it over for the pharmacy pandemonium.
All right. Thank you, Sam. Before we get into the pharmacy pandemonium, I just want to remind everybody that these stories on pharmacy pandemonium are not our stories. These are stories that we find online, people share with us. So just a reminder, don't take these things personally. We share these stories so we could dissect it and then talk about it and engage, because there are better ways of handling things. So not our stories. We'll tell you when they are our stories. So anyways, so this is from a username, FMUpFam14. The title, and just to keep with the nursing theme here, and for this lovely episode, nurse told me this was a HIPAA violation. I work in a rural hospital, level 5 trauma. A patient had come in a few days earlier with a gunshot wound to the head. He was intubated and flown out to a higher level of care. He and his sister walked into our pharmacy tonight looking for discharge meds. They thought they were supposed to be sent to us. I told them I didn't see anything sent to us, but I could call. Good pharmacist. I asked if they wanted to wait or have me call when I figured it out. I didn't know how long it would take. They chose to leave. I called the facility he was transferred to. After 30 minutes of round-robin calls, I found the floor he had been discharged from. The nurse refused to give me any information because I wasn't the patient. They wouldn't tell me where the meds had been sent, what the meds were, or resend them to our pharmacy. I reiterated my position, facility, and purpose for the call. They still wouldn't help me. In quotes, but you aren't the pharmacy we sent the meds to, in quotes. Yeah, I know, that was the entire problem. The nurse said if it had been sent to the wrong pharmacy, the patient needed to talk to the doctor. They wouldn't help me any further. I asked for a different nurse and was sent to the house supervisor. The house supervisor doubled down on it being a HIPAA violation and refused to help me. How in the world was this a HIPAA violation? Eventually, I figured out that it was supposed to be Keppra 1,000 milligrams BID. Now the patient was hours delayed in getting seizure prophylaxis meds following a severe head trauma, all because what I wanted was supposedly a HIPAA violation. I was livid. What if the patient had a seizure because of this nonsense? Okay, so I don't know. I'll say I have personally been on the brunt end too of dealing with this sort of thing, but we'll talk a little bit more about that later. So just starting off, Sam, how would you have handled this situation if you were the pharmacist?
I think initially, when I've had kind of conversations like that, it's like trying to almost prove that like you have the patient information of like going back and forth. I've done that before. It's like, you know, I'm part of the healthcare team too here. Like, here's the patient's date of birth. Like, let me confirm this address with you on where they're going. They called me on this number asking for these meds, like trying to show it's like, yeah, we do have some communication with the patient, their personal information. Like, we know who this is. Like, it's not a random whatever of where it would be a HIPAA. So usually that tends to help. I think at the point of like this situation, like you can't force them. Like, there's nothing you can really do. So, you know, you gotta document it, and you gotta contact the patient and just tell them the situation. I mean, you can try to keep going around them. Looks like they've already kind of tried to make that move. They tried to go above and ask to call him, you know, talk to him, and not just a fax or just said do them themselves. You know, they tried a number of things and didn't end up kind of getting anywhere. And so at some point, it's, you know, you gotta give up. You gotta tell the patient you tried and couldn't get through, and that's kind of as far as you can go in this case.
How about you, Xavier?
Yeah, I mean, I feel like the pharmacist did a good job. Like I said, he asked the nurse, had all the patient identifiers. You know, if you got someone's social, birthday, social address, and all this information, they should believe you. But if not, you know, he did the right thing to escalate and try to go to the supervisor. That didn't work. I guess another like super pharmacist type thing you could do. It is a rural area, so maybe it's not that many pharmacies in the area, and maybe you can just call around and see, like, hey, I had this patient. He said he transferred meds to your pharmacy, and then you can try to with. Let's say it's 5 pharmacies in the area. You might be able to like just figure it out by being a super pharmacist. But yeah, I feel like he handled it well, and I could see lightening upset enough.
So it sounds like you would have, since it was a small area, you would have been the super pharmacist and called around.
I mean, that's just sort of an idea I would have thought of. So would have attempted to do more, depending on how busy we are, and
He would have told the
how much
intern to call.
it would take away. Yeah, yeah. I got an intern that can call around, on rotation.
So yeah, I agree, dude. This pharmacist handled it exceptionally well. I mean, I think a lazy pharmacist would have just opted to start saying, you should just call him and figure out where it is. But they clearly were trying to go above and beyond, calling the facility, waited for 30 minutes to finally find out which floor the patient was on, only to be told no again twice. So by 2 different people, that's pretty insane. So I would have, the only different thing I would have done, and I only know this because I do transitions of care, and I've dealt with this experience before, and I know what works, what doesn't work. So this is a little clinical pearl for anyone out there listening in the same shoes, and you're calling a hospital. Ask to speak to the pharmacy department. I just straight up can I speak to the pharmacy department, a pharmacist? And usually pharmacist to pharmacist, they know, they get it. They'll tell you the information you need, where it was sent. I think, again, I think these nurses were being abundantly cautious. That maybe all this fear happens because something was violated in the past, right? So I'm sure there was I'm willing to bet there was history. Maybe someone cracked down on them for some reason from an irate patient. I don't know. But call the pharmacy. That I guarantee you that'll work 9 out of 10 times if something like this happens. Don't get me wrong. I've talk to pharmacists who are even more kind of like this, and I will only tell you what you ask me. I won't tell you blanket information of the profile, but I've only experienced that from and I don't want to slam on new grads, but new grads who just don't fully understand the capabilities and the liberties you can do with HIPAA and what your rights are. So call the pharmacy. That's the only thing I would have done different there. So that begs the question, Sam, was this a HIPAA violation?
I mean, apparently, according to the nurses, multiple nurses have confirmed HIPAA violation. Not that I'm aware of. I could be wrong. Maybe the nurses are right. But having, being, again, a part of that treatment team or looking for treatment, and that being able to get that information for the patient, especially since you were specifically requested from the patient to essentially look into that medication that they want and to fill through you. So I would not think of it as a HIPAA violation, but clearly some people did that they were concerned with.
Xavier, what do you think?
I would also say no. Healthcare professionals are allowed to share information with other healthcare professionals as long as you can confirm information and verify who you are and verify who the patient is. From my last understanding of HIPAA laws, that is allowed.
Yeah. This is not a HIPAA violation. Let me tell you guys straight up right now. It's not a HIPAA violation. If it's your patient and their patient, you can request information if it pertains to the patient's care that you are trying to actively give the patient. Not a HIPAA violation. I can't tell you many times I had to explain that to people. Again, I think this nurse was just being abundantly cautious. And then, maybe the supervisor, after hearing all this, their pack, they're not going to be like, they were wrong, I'll tell you the information, right? They got to stick together, so I get it. But definitely not a HIPAA violation. You can get that information without an issue, especially if the patient asks you to do it. So this is why there's no doubt in my mind. This patient came from the initial facility that this guy was calling from. So this person already had a relationship to the patient. I kind of already gave this away here, my end, but I want to hear your guys' thoughts here. How would you explain the HIPAA treatment exemption to a colleague that refused to share this needed information?
I would say, similar, but again, the idea of trying to show as well that you have that patient information, like you've been in contact. It's this is at the request of the patient. We are doing this to improve healthcare for this patient. It's not some random thing or call or getting information. This is for the patient, and that being the most important part Like that is what we're trying to do here.
Yeah, exactly. How about you, Xavier?
I'll do the easy way. Pull up the laws, go to what page, chapter, subsection.
We tried that before,
One,
man.
one.
Honestly, we did. We had like a
You
whole
go to
sheet that our
you
text
shall
would read.
blah 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 blah
Yeah.
blah blah.
Yeah, no, we used to do that. It still didn't work for some people. It's like substatute this, blah 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 says this. You are in violation of. You are the one in violation of HIPAA, and they're just like, call medical records. I don't want to deal with you. So usually when you start pointing fingers, they don't want to deal with you.
I am the law.
Have you guys ever experienced a situation where you couldn't get information because someone was being overly cautious with the whole HIPAA law, Sam?
I mean, I think it comes up sometimes with, because we do both human and vet med, where like we're asking for a transfer and like the person's calling like for themselves, we're trying to transfer it and it's like for a pet. And so like everything doesn't match because the name doesn't match. And so like we won't get a transfer. Like someone won't come from another pharmacy, like give it to us without realizing it. We're just like, nope, there's no patient here for that name. Sorry. Like that. Nope, no patient. And then realize it's like they were asking for their pets, whatever, or, a pet, and it was actually for the human. Like we thought it was for a pet and it was actually for them on this one that we've done pets for before. And so like getting information, that's probably the only thing that I really remember of it being an issue. I guess people calling in about information and things like that. Again, going back to like the medication aid and diet and unique things. Again, a lot of unique rules involved with that. But some of the concerning or questionable things is with family members. Well, obviously, sensitive subject, and some family don't believe in it or don't want them to be a part of it. So we have had things where like family members call and say, like, oh, they don't want that, or they try to buy it and purchase it and get it so their family member can't get it. Like it's quite rare, but it has happened before where someone has tried to buy it, whatever. You're like, yeah, I'm whatever, Aunt Susie, and I'm going to get the consult and pay for it and come pick it up. And essentially, like, sorry, we have, their daughters approved to talk about this. That's it. We can do that with you, but we got to get this approval first, and like going back and forth, and then finally calling the doctor or whoever, the family, and finding out. It's like, no, that's where
This person,
that person is trying to, do whatever nefarious about it. So pretty rare, but has happened before of that specific med, people trying to interfere with that. But I'd say other than that, there was one instance I remember of a husband calling in for his wife. And again, this is before we started anything. He was also a pharmacist, actually, and had a conversation about him. Obviously, we're doing custom stuff, so we're talking about different topical combo creams for his wife, and if we have the ability to make it, what we can make, strengths, and like how we do it, how he wants the sig and all this stuff. And so I'm talking to him, and we're going all over all these things, and then ends up, I can't remember if they had it written or they had it transferred to us. And then once we got it transferred, it was just the wife's info on there. And so I think he had called in, and I was like, yeah, we got this script. Like, I don't see you on here. Let me, she's available. I can get you authorized or whatever. And, he pretty much just kind of like slowly started going off on it, getting upset initially. Probably like once he really got going, like the big thing was like, oh, you're pretty new, aren't you? Like you just graduated, you're like on this thing. And then it's like, I think I was maybe 2 years out of school on this, and I was pretty much like, yep, yeah, I'm pretty new. It's like, I just need to talk to your wife, and we can get that authorized. And then I think he dropped the owner's name. Like I know who the owner is and this and whatever, and then ended up speaking to someone else, and pretty much, just had my back on what it was. It's like, oh yeah, great to talk to you, all this, like, yeah, can we just, have your wife call in or talk to your wife and get you on here. And so it turns out like, this happened over a week or so, maybe of calling back and forth and like looking him up. And it's like, yeah, he is a pharmacist. He's at a university and he sits on the ethics board for like the university, or like for the state. Like he is like for the state university, like out of state for us. And like I was like telling this to another of the pharmacists there, and he was like, how is he so upset? Like, wouldn't he be like, I can't remember the words, like, wouldn't he be proud of us? Like, we're sitting here like following the
Best
rules. Like this is
practice,
his job, like ethics
Yeah.
and like the rules of things and going down. It's like, yeah, we're protecting your wife on this information on someone that could be harming. Like we don't know what's going on. And it's like, this is what he does. And like, he was just so upset. And then finally his wife called, got him authorized. Like, I think we filled meds for her for a few years, of different things. But like just this initial back and forth of him just being so upset because we wouldn't fill or wouldn't directly deal with him. And I think what really, again, set him off is because I talked to him so much ahead of time before we had a script on like what we could do, how we would design it and all this stuff. But once we got it, like I wouldn't talk to him about like, yeah, just let me get you on here for your wife and we can get this going. And it just went downhill from there. Yeah.
I mean, what if they recently divorced,
Who knows?
Yeah, that's true.
They're like, oh, I don't like him anymore.
Man, I teach the law, so I am above the law. That was my takeaway from that. Yeah, so for me, when our transition to care program was newer, I should say, it was hard. I did experience this challenge a lot because I would say, hey, I'm calling from so-and-so hospital. You'd be like, what? No, you're not. They never call here, So it was hard because we were, because it was a new program we were starting, and just be me trying to call a methadone clinic. I'm like, hey, I need to know what dose this person is taking so we can continue it, so we can continue the plan of care for their darn methadone. They're like, no, I don't believe you. That they never call here. No, I swear I'm legit. And so, yeah, exactly. And it's just like with a methadone clinic, there's not really a pharmacy. It's just like they dispense it daily to, for administration from like nursing department. So I get why where they were coming from. So, for cases like that, I just had to keep calling, make sure they were familiar with me. I did have to, occasionally send like a release of information to people till I started developing rapport. They knew that I wasn't just some made up fictional character calling from said hospital, right? So it was challenging at first, but it's definitely a lot easier now. I've learned a lot of tricks, big one being just call the pharmacy department, and try not to get a new grad. So those are my two pearls of wisdom.
Where's your preceptor at?
Yeah. And then, even better, when you finally do get in touch with the department you need, save that number so you can call them directly. So you don't have to go around that rigmarole. So, yeah. So then, last question. Who's ultimately responsible for ensuring the patient gets the discharge meds? Is it the first hospital, second hospital, or something else? Someone else? Sam?
I mean, I would say once you start that kind of daisy chain of handing things off, it's kind of being probably the initial pharmacy, initial hospital of trying to make sure that as best you can, that transition does happen properly. Obviously, no one person can control everything. At some point, you're handing it off or transitioning. Like you got to trust in the procedures, the system to get there. But it probably starts at the beginning of getting everything squared away as it should be, and then proceeding from there for patients.
Well said. Xavier, what do you think?
Honestly, it might be the patient though. If he wants his meds, he need to figure out where they are and assist the pharmacies in getting them. If he can assist a little bit and say, hey, doc, I'm at this pharmacy. You send it to a different one. Can you send it to which pharmacy do you send it to so I can tell them to get it for me? So it would be nice if the patient helps because it's for them. But some patients don't care, and we care, so we kind of do it as much as we can for them. So
you got to advocate for yourself. That's what you're saying.
Yeah. I mean, you're the patient. You gotta, you need your meds. You need these meds so you don't have a seizure. You need to be figuring out what's going on as well while we are trying to help you figure out what's going on.
Yeah, I definitely agree. I do think there is a big responsibility on the patient. Ultimately, they're the ones taking it. So they are ultimately responsible. Like once the meds are with them, no one's administering to them but themselves, right? So there is a big responsibility on their part. But I do think there is also a shared responsibility at least with the pharmacy they were trying to fill it at, only because they took it on themselves to be like, I'll call around, maybe make sure we can get it. I think at that point, it does become your responsibility because you sort of accepted it as your own. But yeah, totally agree. I think the bulk of the responsibility does fall on the patient because no one's checking on you to make sure you're taking it once you actually get it, right? That's all you. So anything you guys want to add?
I think it was pretty good discussion. Fun topic to talk about, HIPAA. Don't do any HIPAA violations, guys. Fun.
Follow the law. That's what you're saying.
Yeah.
Sam, you got anything you want to add?
Use your brain.
Just love your nurses, doctors, pharmacists, techs, anyone that's trying to help you. They are trying to help you, even though sometimes you might not think it. They do want you to get your meds, get your medicine, get your health better, whatever it may be. They are on your side.
Yeah. Well said. Same team. We all work together to help a single individual, which is the patient. Well, guys, that's it for today's episode. Thank you all for joining us and tuning in. Want to reiterate, we love nurses. Thank you for making our lives easier. This was not an episode of Slam on Nurses. We appreciate you guys. We know you guys do lots and lots of stuff. You guys are underappreciated. I hope that these hospital cuts don't affect you all, because we need you guys around, and it's very, very scary time to hear about everything, and I hope you guys are doing okay out there.
Well said. Well said. Please like and subscribe. We got Spotify, the iTunes, TikTok, Instagram. It all helps. Hit those little like buttons.
And don't forget to send us your questions or something, slide into the DMs. Hit up the website. We changed it up a little bit, so check that out. Send us some questions on there. And happy 4th of July to you all. Have a great holiday and stay safe. Don't blow anything up.
Yeah, because Xavier will treat you, and you're screwed.
I'm going to take it to the ER.
Bye, guys.
Peace.
Peace out.